The doctors of the urology clinic at 45 Francis Street are dedicated to treating patients with a wide variety of diseases. They also work with research scientists to better understand urological diseases and to publish in medical journals. We are doing a research study to find out if a new PDE5 inhibitor can help patients recover their erectile function after a nerve-sparing radical prostatectomy. To join the study, you must have regained at least some of your preoperative function. We may have given you some information about the study during a clinic visit. If you are interested, we will schedule a screening visit to answer your questions and see if you are eligible to participate. You will need to arrive fasting in order for us to measure your cholesterol and glucose levels, but we will give you a small breakfast. We will also give you a parking sticker and a small gift certificate, and we will ask you to sign the informed consent document with Dr. Who. During the screening visit, we ask you questions about your health and the medications you are taking. We measure your weight, temperature, your sitting and standing blood pressures, pulse, and respiratory rate. We go to the Brigham clinic on the second floor to obtain an electrocardiogram and to collect several blood samples for standard testing and hepatitis and AIDS screening. We ask for a urine sample for standard testing and illicit drug screening. We also perform an alcohol test. You'll also complete a questionnaire, the International Index of Erectile Function, which measures your erectile function, and we give you a study diary to fill out at home when you have sexual intercourse. You should attempt at least 4 times to have intercourse with your partner between each visit, and should return the study diary at the next visit. The results are recorded anonymously and are not included in your medical records. It may take a week to get the lab results back to our office. The test results will determine whether you qualify for the study. You will start taking the investigational drug after the randomization visit. During this visit, you return your study diary and complete a new erectile function questionnaire. We also measure your vital signs. If you qualify for the study, Dr. Who signs a prescription and we go to the investigational drug pharmacy in the hospital to receive your study drugs. You will be assigned by chance to one of 3 study groups, the 100 milligram or 200 milligram doses of the study drug or the placebo. You receive at least 8 doses per month, that is 16 tablets, for up to 3 months. You will take 1 dose about 30 minutes before sexual activity. You can take another dose the following day, but you should not repeat the dose during the next 12 hours, as this may trigger a drop in blood pressure. You will come to the clinic for a monthly follow-up visit. During this visit, you return your blister cards and we ask you whether the study drug had any side effects. You should contact Dr. Who immediately or come to the clinic when you become aware of any side effects. We also ask whether you have started any new medications. You also return your study diary and we ask you to complete a new erectile function questionnaire. You will receive 8 new doses of the study drug and a new study diary to fill out at home. We also measure your vital signs. During the last visit, you also see Dr. Who to speak about your next treatment option. He may refer you to Dr. O'Leary, an ED specialist, to try an injection or discuss other treatments. We obtain an electrocardiogram and collect several blood samples to see if the study drug had any side effects. Remember to ask for a parking sticker at the end of each visit. We will enter your anonymous information into a database. About once a month, a monitor from the pharmaceutical company will come to verify that the data are correctly recorded. The monitor will also verify that the hospital research committee has approved the study. The anonymous information from all the subjects will be sent to a statistician, and the results will be presented to urologists in medical meetings. They will also be sent to the Food and Drug Administration for a review. We hope this presentation helped you decide whether you are interested in participating in the study. Before joining the study, you will need to sign the informed consent, which contains detailed information about the study, the investigational drug, and the protection of your medical information. You will also find in our clinic some information about other studies. Our studies sometimes have enrolled only a few volunteers, but a few have enrolled many volunteers.